Okay, today for my treatment room talk, I want to talk about a conversation that I had with a client who came in with acne. This is going to be specific to acne prescription medication and the side effects and how to deal with the side effects of it. I get a little bit frustrated when clients come in, not at the clients, but at the prescribing doctor who hasn't talked to their client about the side effects and what this prescription is actually doing in their skin. And when this happens, the client is not able to adjust to what is happening. So, in this, I want to talk about specifically spironolactone and the changes that it makes to your body and the side effects that has that affect your skin and what you can do to help with those side effects. So spironolactone was actually first put on the market as a blood pressure medication. So it is for high blood pressure. And the way that it works for that is it is a diuretic. So it gets rid of the excess water that's in your body to help with your blood pressure. So it also happens to block androgen hormones. And that is the way that it helps with acne. So androgen hormones are the quote unquote male hormones. So everybody has them in your body, whether you're male or female, but in males, they produce it in a higher dose, whereas females don't produce quite as much of it. And this blocks the androgen hormones. So androgen hormones are the hormones that decide how much sebum you're producing, which is the oil in your skin. And acne can start when you have an excess amount of sebum, which causes blockages in your pores. So the hope of this medication is that by blocking the androgen hormones, it will lower your sebum production and thus have like a domino effect to where you don't have that blockage and you don't have that acne anymore. It tends to work on like 50 to 70% of the people that go on it. So sometimes it works, sometimes it doesn't. And it takes about 3 months to really figure out if it's working or not. Some people, you start to see results in a few weeks to a month, but you really need to be on it for 3 months before you decide that it's not working. So the side effects of this are pretty steep. The first one that I'll talk about, which actually has nothing to do with your skin, but I think it's really vitally important that women that are on this medication know, is that you really should not become pregnant while you're on this medication. So you need to take really active role in making sure that you do not become pregnant, because the birth defects can be very severe. So most doctors won't prescribe it to you unless you are on some form of birth control. And that's not really a bad idea. Actually, the studies have shown that if you're on the birth control pill while taking spironolactone, you tend to have better results for some people. Some people, birth control can actually cause acne. So you do have to decide for yourself which form of birth control is best. But do definitely make sure that you are aware that severe birth defects happen when you are on spironolactone and become pregnant. The other thing that doesn't have anything to do with your skin or too much to do with your skin is it changes your periods typically. So you can have more heavier, irregular periods. And that's just something that happens when you're messing around with your hormones, which is pretty self-explanatory. For your skin, you want to make sure that you are drinking enough water because it's a diuretic. So it's pushing water out of your system. So you are going to become dehydrated in your skin a lot easier. So it's really important to make sure that you're drinking enough water and eating enough water-heavy fruits and vegetables. The fruits and vegetables is definitely something you should not ignore, because when you have a diuretic and you drink water, your body's immediately trying to flush out that water. When you are eating water-heavy fruits and vegetables like celery, watermelon, oranges, strawberries, your body will hang on to a little bit more water because it takes a little bit longer to digest it. So definitely make sure you're trading like your snacks, like chips or dry cereals or toast, things that are dehydrating in nature for hydrating foods, because you want to definitely focus on getting enough water into your diet. It is very easy to become dehydrated with this because it is a diuretic. The other thing is that it's lowering your sebum level. So your skin will be drier. So if you didn't have super oily skin to begin with, this can start to be a little bit of a problem. Your skin may start to feel really tight and really dry. And the dehydration and the dryness can become a problem to your skin's ability to have a functional barrier. So you can start to notice like a little bit diffused redness all over your face. You might start to feel that tight, dry feeling. You might feel like your skin's just not absorbing anything anymore. And those are signs that your barrier's functioning is starting to be compromised. So that's definitely something you want to pay attention to. The other thing I really wanted to let you know is that one of the side effects is a high potassium level. So one of the special things about spironolactone is that it's a diuretic that helps you hold on to potassium. So instead of just flushing everything out of your system, the potassium it will hold on to, because your body does need potassium for sure. And a lot of diuretics just flush everything out, the water and electrolytes and everything. So because your body is holding on to that potassium, you can actually have too high potassium levels if you're eating or drinking a lot of potassium. So a lot of people don't know where they're getting a lot of potassium. We think bananas, and that is very true. And we think Gatorade for electrolytes, but actually Gatorade is not a very good source of potassium. However, milk is a very high source of potassium. So you want to limit your milk intake if you're on spironolactone. Also, coffee is a source of potassium. So if you're having like 3 cups of coffee a day, you could be getting too much potassium into your diet if you're on spironolactone. So definitely take a look at that. Orange juice is another one that we automatically put with a healthy food. And it is healthy as long as it doesn't have too much sugar in it, but that's a different conversation. But it does have a lot of potassium in it, so you don't want to have a ton of orange juice when you're on spironolactone. So if you have any questions about this, let me know. If you're on an acne medication and you have questions about it, ask your doctor. There's definitely a lot of sources out there to read about to make decisions about whether this is best for you or not, and your doctor is a great source for that. Otherwise, I will see you later. Have a wonderful, happy week.